You might be shocked to learn that consuming the wrong types of nuts regularly can increase your cardiovascular disease risk by up to 48%, especially for older adults. This startling statistic isn't just a random number. It comes from extensive research published in the American College of Cardiology journal, spanning multiple years of careful study. Here's what's truly alarming. Some of the most common nuts sitting in your pantry right now could be silently elevating your blood pressure, triggering inflammation, clogging your arteries, and even accelerating mental decline. Many seniors consume these nuts believing they're making healthy choices, completely unaware of the potential dangers lurking within. One particular nut, which we'll expose later in this video, contains dangerously high levels of a toxic compound that, when eaten regularly, can damage your liver, kidneys, and brain function. This same nut is probably sitting in your kitchen cabinet right now. It's the very one that keto dieters frequently praise as beneficial, yet it may be silently wreaking havoc on mature bodies. Don't worry though, we've got your back. This comprehensive video guide will reveal which nuts are the safest choices, which ones protect your heart, which boost brain health, and most importantly, which ones you should eliminate from your diet immediately. Make sure you watch until the very end, because we'll expose a disturbing truth about the most dangerous nut that hardly anyone talks about, and it could be harming your health right now without you realizing it. Before we dive in, please hit that like button and subscribe to our channel for more life-changing health content. Also, drop a comment telling us where you're watching from. We love connecting with our global community. Now, let's explore the 4 essential nuts that seniors should be incorporating into their daily routine. Number 4. Almonds, the ultimate bone-strengthening champion. Almonds deserve recognition as one of the most powerful foods for aging bodies, primarily due to their exceptional calcium and vitamin E content that work together to maintain bone density and strength. As we age, fracture risks become increasingly serious, since our bones naturally become more fragile and porous. After 65, natural bone deterioration accelerates significantly. But consuming just a quarter cup of almonds daily can help slow this process by delivering approximately 97 milligrams of calcium. What makes almonds truly special isn't just their calcium content, but also their rich magnesium levels. A mineral that many older adults are deficient in, magnesium acts as a crucial transport agent, ensuring calcium reaches your bones rather than accumulating in your arteries, where it could cause damage. The beneficial monounsaturated fats in almonds also support cardiovascular health by reducing harmful LDL cholesterol levels, which becomes increasingly important as heart disease risk climbs with age. For seniors, I recommend consuming 15 to 20 almonds daily, preferably raw or dry roasted without added salt. These nuts also serve as an excellent remedy for constipation, due to their impressive fiber content of about 3.5 grams per serving, a common issue affecting roughly 40% of elderly individuals. Most importantly, research from Tufts University demonstrates that almonds can help prevent the oxidative damage that many fear will affect their brain cells as they age. Choose almonds with their skins intact, as the skin contains flavonoids that, when combined with vitamin E, double the antioxidant power. Important warning: almonds can pose a choking risk for seniors with swallowing difficulties, so ensure you chew them thoroughly before swallowing. Number 3. Walnuts, the brain-boosting powerhouse. Walnuts earn their reputation as premier brain food for seniors, and their brain-like appearance isn't just coincidental, it's symbolic of the organ they help nourish. These remarkable nuts contain the highest concentration of plant-based omega-3 fatty acid, alpha-linolenic acid, among all popular nuts. This is particularly crucial for aging brains, as omega-3s support neurotransmission and maintain brain cell membrane integrity. Studies show that seniors who consume just 1.5 ounces of walnuts daily for 8 weeks experienced significant improvements in cognitive processing speed and mental flexibility. Recent research published in the Journal of Nutrition reveals that walnuts' unique polyphenolic compounds can cross the blood-brain barrier and combat inflammation in neural tissue directly, potentially slowing the progression of neurodegenerative diseases like Alzheimer's and dementia. Here's something most people don't know. Walnuts naturally contain melatonin, and since melatonin production typically decreases with age, this can lead to sleep difficulties for many seniors. Some people find that eating a handful of walnuts before bedtime helps improve their sleep quality. Walnuts also provide tremendous cardiovascular benefits through their combination of arginine, an amino acid that supports blood vessel function, and polyphenols that reduce oxidative stress. In fact, walnuts can enhance the effectiveness of blood pressure medications by helping seniors maintain arterial flexibility. For maximum benefits, store walnuts in the refrigerator to prevent their delicate oils from becoming rancid, and aim to eat 7 to 9 walnut halves daily. As a bonus tip, cracking them yourself when possible helps maintain fine motor skills. Don't be deterred by walnuts' naturally protective bitter taste. That slight bitterness actually indicates their potent antioxidant content. Number 2. Pistachios. The blood pressure regulator. Pistachios might be the most undervalued nut when it comes to senior health benefits, particularly for blood pressure management. What makes pistachios unique is their ideal mineral balance. Low sodium content paired with high potassium levels, approximately 285 milligrams per serving. This mineral balance is especially beneficial for seniors because it helps prevent salt retention in the kidneys as we age. The potassium in pistachios can reduce systolic blood pressure by 3 to 5 points, similar to some prescription medications, but without any adverse side effects. Pistachios also deserve special mention for their lutein and zeaxanthin content. These carotenoids concentrate in the eye's macula and provide protection against age-related macular degeneration, the leading cause of vision loss in people over 60. The satisfying crunch of pistachios won't pose the same risk to teeth and gums that harder nuts might present to seniors. Their distinctive green and purple colors aren't just visually appealing. They indicate the presence of antioxidants that help neutralize free radicals responsible for accelerating aging throughout the body. The practical aspect of pistachios makes them perfect for seniors. The shell-cracking process naturally slows consumption, preventing overeating while providing a mindful eating experience that can be both calming and cognitively stimulating. Research published in the International Journal of Obesity found that the visible empty shells help seniors better control portion sizes by providing a visual cue of consumption. For those with arthritic hands, look for pistachios that are already half-opened to make shelling easier. Aim for about 49 pistachios daily, roughly 1 ounce of unsalted or lightly salted varieties. The 3 grams of fiber per ounce in pistachios is particularly valuable for blood sugar regulation, which is crucial for the 25% of Americans over 65 who have diabetes or prediabetes. Number 1. Brazil nuts, the thyroid function savior. Brazil nuts earn the top spot because they address thyroid function, a critical but often overlooked aspect of healthy aging. These exceptional nuts are nature's richest source of selenium, providing 96 micrograms, 137% of daily requirements, in just 1 nut. This is extremely significant because thyroid disorders affect up to 20% of people over 65. And many cases go undiagnosed because symptoms are frequently mistaken for normal aging. Selenium, abundant in Brazil nuts, is essential for thyroid hormone activation, which supports energy production, metabolism, and mood regulation. Beyond thyroid support, the specific fatty acids in Brazil nuts help preserve myelin, the protective coating around nerve cells that often deteriorates with age. This myelin maintenance may help seniors maintain their reflexes, reaction times, and cognitive processing speeds. What's fascinating about Brazil nuts is that their selenium is organically bound, making it more bioavailable and easier for your body to utilize compared to synthetic selenium supplements. Brazil nuts are so potent that you only need one or two to experience their benefits, and their rich, creamy texture makes even small amounts satisfying. Due to selenium's potential for toxicity in excess, I recommend seniors consume no more than 1 to 2 Brazil nuts daily. When shopping, choose Brazil nuts still in their shells. This natural packaging preserves nutrients longer. Store them in the refrigerator due to their high fat content to prevent rancidity. Brazil nuts provide an added benefit for seniors struggling with constipation through their combination of fiber and natural oils that support digestive regularity. Their naturally sweet, buttery flavor makes them an excellent alternative to less nutritious comfort snacks that many elderly people gravitate toward. The most exciting recent evidence suggests that certain antioxidants in Brazil nuts may slow the natural shortening of telomeres, the protective caps on chromosomes that typically shrink with age and influence cellular aging. For anyone 65 or older, these nuts are truly ideal. The dark side: nuts that seniors should avoid or limit. Now let's discuss the nuts that some seniors may want to avoid or consume with extreme caution. Danger number 4. Peanuts, the inflammatory trigger. Despite their popularity, peanuts present multiple risks for seniors. First, peanuts aren't actually nuts. They're legumes that grow underground. This makes them susceptible to mold and aflatoxins, which are mycotoxins naturally produced by certain molds that can damage the liver and potentially increase cancer risk with regular consumption. As we age, our body's detoxification systems naturally become less efficient, making this risk more significant. Even more concerning for seniors is that peanuts contain proteins that can trigger inflammatory responses in many people, even without a true allergy. This low-grade inflammation can worsen joint pain, cardiovascular stress, and cognitive decline, conditions that aging individuals are already predisposed to. Peanuts' high omega-6 content contributes to the inflammatory imbalance that most Americans already face, as we typically consume excessive omega-6 fatty acids compared to anti-inflammatory omega-3s. Many physicians fail to warn elderly patients about the potentially dangerous interaction between peanuts and blood thinners like warfarin due to peanuts' vitamin K content. Commercial peanut products make these issues worse with added hydrogenated oils, excess sodium, and sugars that strain aging cardiovascular systems. Even natural peanut butter without added salt can elevate blood pressure, a particular concern for the 63% of American seniors who already have hypertension. Poor storage causes peanuts to become rancid and produce harmful free radicals. The common practice of dry roasting peanuts commercially also creates acrylamide, a compound with potential cognitive impairing effects, especially concerning for those already worried about memory loss. Even if you've eaten peanuts regularly without obvious problems, switching to our recommended nuts for just 3 days a week can help you obtain better nutrition while reducing exposure to these harmful compounds. Danger number 3. Cashews, the hidden sugar bomb. Cashews pose unique risks for seniors due to their unusually high carbohydrate content and glycemic impact. Unlike true tree nuts, cashews contain significantly more carbohydrates, about 9 grams per ounce, and fewer protective fiber compounds. This creates a blood sugar response that can be problematic for those with diabetes or prediabetes, conditions affecting 25% and 48% of people over 65 respectively. This is particularly concerning because cashews have a healthy reputation, leading many seniors to consume large quantities without considering their blood sugar impact. The smooth, curved shape of cashews also presents a choking hazard that shouldn't be overlooked, especially for individuals with swallowing difficulties. They're among the most commonly aspirated nuts in seniors. Nutritionally, cashews are problematic because they're high in oxalates, compounds that can bind with calcium in the digestive tract and reduce calcium absorption. This is a significant concern for seniors already at risk for osteoporosis. These same oxalates dramatically increase kidney stone risk after age 60 for those already predisposed. There's also a hidden issue with cashew processing. The extensive processing required to remove urushiol, a toxic compound also found in poison ivy, strips away much of their nutritional value. Many commercial varieties are oil-roasted and heavily salted, adding harmful fats and sodium that can worsen blood pressure and heart strain. Cashews contain enzyme inhibitors that can interfere with protein digestion, particularly problematic for seniors who already struggle with digestion and protein absorption. The creamy texture of cashews makes them easy to overconsume, potentially contributing to weight gain during a life stage when maintaining healthy weight becomes increasingly challenging. Consider replacing cashews with walnuts or almonds regularly for a healthier snack that poses fewer risks to aging bodies while providing superior nutritional benefits. Danger number 2. Macadamia nuts, the calorie bomb. Despite their delicious taste, macadamia nuts present significant health risks for seniors due to their extremely high calorie density. They're the most calorie-dense nut available, containing about 200 calories per ounce. This adds extra strain to weight management challenges that seniors already face, as metabolic rates naturally decline with age. Their extraordinarily high fat content, about 22 grams per ounce, can exacerbate the gallbladder's already reduced efficiency. For the 15% of seniors with asymptomatic gallstones, macadamias can trigger painful episodes that might otherwise remain dormant. Beyond their calorie load, macadamias contain among the highest saturated fat levels of any nut, about 3 grams per ounce, which can raise LDL cholesterol levels, already a concern for many seniors. Their density and hardness pose a serious threat to seniors' oral health, particularly those with crowns, bridges, or weakened teeth. This becomes especially problematic after 65, when enamel naturally weakens due to wear and reduced calcium absorption. From a practical standpoint, macadamias are among the most expensive nuts, potentially leading budget-conscious seniors to purchase cheaper varieties that are more likely to be rancid or improperly stored, exposing them to more harmful oxidized fats. Commercial macadamias often come oil-roasted and heavily salted, adding more sodium and damaged fats to their already poor nutritional profile. Their rich, buttery taste can lead to overconsumption, particularly for seniors who may have dulled taste sensitivity and prefer stronger flavors. It's concerning that many seniors eat macadamias, thinking they're supporting heart health. But most research showing nuts' cardiovascular benefits has largely excluded or minimized high-fat nuts like macadamias. If you've been enjoying macadamias regularly, consider switching to pistachios, which offer a significantly superior nutritional profile specifically suited to aging bodies. Danger number 1. Pine nuts, the medication disruptor. Pine nuts rank as the most problematic nuts for seniors due to several factors that are particularly acute for this demographic. Most concerning is their content of compounds that interact with over 60% of medications commonly prescribed to seniors, potentially reducing drug effectiveness or introducing dangerous side effects. This is especially true for statins, certain antidepressants, and blood pressure medications frequently prescribed to those over 65. Most doctors and pharmacists never warn patients about these food-drug interactions, which represents a major oversight. Pine mouth syndrome is the most troubling concern, as it causes pine nuts to leave a bitter, metallic taste that can persist for weeks after consumption. While this might seem minor, it can have catastrophic effects on seniors due to the strong correlation between taste alterations and reduced appetite and nutritional status. Research shows that up to 42% of affected individuals experience significant weight loss. The syndrome appears more common in seniors, possibly due to age-related changes in taste receptors and detoxification pathways. Pine nuts are high in polyunsaturated fats that can rapidly oxidize and create inflammatory compounds, concerning for seniors already dealing with inflammatory conditions like arthritis. Their small size and slippery texture can cause aspiration, particularly worrisome for seniors with swallowing difficulties or those taking medications that cause dry mouth, a problem affecting over 70% of seniors taking multiple prescriptions. Pine nuts, enzyme inhibitors, can impair protein digestion at a time when the body's ability to absorb protein naturally decreases with age. As a calorie-dense food due to their high oil content, pine nuts can contribute to weight management issues common after 65, even when consumed in pesto, their most common culinary application. Alarmingly, emerging research suggests compounds in some pine nut varieties may accelerate age-related macular degeneration, the leading cause of vision loss in seniors. Conclusion: your health journey starts now. These are the 4 nuts you should avoid after 65. The choices you make about which nuts to include or exclude from your diet can dramatically impact your health, vitality, and cognitive function during your golden years. Remember, consistent application of small changes produces enormous long-term results. Now it's your turn to engage with our community. Have you noticed any health effects from adding or removing specific nuts from your diet? Which nut has made the biggest difference in your life? Share your experiences and insights in the comments below. We truly value your input and love hearing from our viewers.